Chapter 14, Prescription and Over-the-Counter Drugs. This is the full video of my lecture for the Substance Use Disorder Counseling and Chemical Dependency classes. In this video, we will examine several drugs that are not commonly thought of as drugs of abuse. Included in this chapter are such things as prescription medications, steroids, over-the-counter pain relievers, cold and allergy meds, diet pills, and sleeping aids. We will also briefly discuss herbal products and inhalants. This video is by David Joel Miller. Some of the material previously appeared on my blog, counselorsoapbox.com. Photos courtesy of pixabay.com and Wikimedia Commons. Prescription drugs can have psychoactive properties. In the prescription RX group, we have to consider such things as birth control pills, anabolic steroids, other steroids, and other prescription medication. Over-the-counter drugs include pain relievers, analgesics, cold and allergy meds, diet pills, and sleeping aids. We'll also look at herbal remedies, home remedies, hormones, diet supplements, and GHB, which was a supplement in the past but has now been moved to Schedule 1 and may not be prescribed. Birth control drugs can cause mood changes and severe depression. Side effects may also include things like risk of blood clots, strokes, and heart attacks. Anabolic steroids are synthetic drugs similar to the male sex hormones. They've been often used and abused because of their ability to increase muscle mass and athletic performance. Possession without a prescription has been illegal since 1990. They are a Schedule 3 controlled substance. Often, anabolic steroids are detectable in the urine for 4 to 14 days after use. Some positive tests can occur 13 months after the last use. There are some legitimate uses of anabolic steroids. If your eye is scratched, you can use drops to prevent scarring, and anabolic steroids can be injected directly into joints to promote healing at the site of the injury. There are some side effects from using anabolic steroids, though many users will take the risk in order to get the big muscles. Side effects include acne, balding, reduced sexual desire. In men, atrophy of the testes, they shrink up maybe to the size of a pea, and men may grow breasts. Women grow facial hair, go bald, have breast shrinkage, and menstrual irregularities. Women's voices often get deeper. The steroids, anabolic, can increase cholesterol, increase the risk of heart disease, cause liver damage leading to liver cancer, irritability, aggressive, violent behavior, and a phenomenon called roid from steroid rage, as well as psychotic reactions. Some psychological effects of steroids: mild euphoria, increased energy levels, aggressiveness, irritability, violent behavior, mood swings, and psychotic reactions. Users have higher than expected rates of death from violent causes, probably because they get into confrontations with other users. There are withdrawal symptoms, and anabolic steroids can lead to dependence and cravings. Over-the-counter drugs can include a great many things. They were not FDA regulated until 1962. They are studied by the ingredients rather than the brand names, and different brands can have varying amounts of various ingredients. There are two categories to consider in this: GRAE, generally recognized as effective, and GRAS, generally recognized as safe. Many, many years ago, they had a product that was given to people orally. In those days, it was common for humans to have intestinal worms. They picked them up from food that was less than sanitary. And they had chemicals that the person could swallow that would kill the worms. Unfortunately, most of those chemicals were things like arsenic that were also poisonous to the person. While they were effective, they were not very safe. Also, we've seen some ads for particular elixirs, beverages that are supposed to have magical properties. They help with weight loss, reduce headaches, and so on. Some of these products are little more than water, which has had some food coloring added. These products are generally recognized as very, very safe. Drinking water is certainly safe within a relevant range. It's hard to drink so much that you get sick. But they are not, water and coloring are not generally recognized as effective. What you want for any medication, prescription or over-the-counter, are medications that are both generally recognized as effective and generally recognized as safe. Some of the major types of over-the-counter drugs are pain relievers, better known as analgesics, cold and allergy meds, some stimulants, though many of those have been withdrawn from the market, and some milder sedatives. Analgesics, 4 principal types of analgesics that are available over the counter. Each has its good points and its potential problems. Aspirin increases bleeding, though it can be used to thin blood and prevent heart attacks. Aspirin can also be hard on, irritating to the stomach. Acetaminophen is commonly sold as the brand name Tylenol, but this medication can be very hard on the liver. If taken in excessive quantities, it can cause the liver to be damaged permanently, even leading to death. People who have a history of alcohol abuse and have a damaged liver or have viral infections probably should avoid acetaminophen. Ibuprofen and naproxen are also very effective pain relievers, both of which are metabolized in the kidney. Therefore, it's very important for anyone with kidney problems or anyone with normal kidneys not to abuse ibuprofen or naproxen, because when taken beyond the label recommended dosage, both of these products can damage kidneys and in excessive doses lead to kidney failure. Aspirin is acetylsalicylic acid. Salicylic acid is found in willow bark, was used by Native Americans, ancient Greeks, and so on, as an herbal remedy. But again, taken in too large a quantity, it can irritate the stomach. Analgesic relieves pain without causing unconsciousness. Antipyretic, meaning it reduces fever. Anti-inflammatory properties, it reduces swelling. Aspirin is not very effective at treating sharp pain or stomach pain. Some adverse effects are that it may irritate the stomach, may result in excessive bleeding, produces a syndrome in children with the flu or chickenpox that's very serious and dangerous, and is an anticoagulant that prolongs any bleeding that occurs for any other reason. But this blood thinning may also be beneficial, may prevent heart attacks and strokes. Acetaminophen, brand name most people know it by, is Tylenol. The pros: it reduces pain, it reduces fever, does not irritate the stomach. The cons: it's not an anti-inflammatory. If you have swollen muscles, you need something else. It may cause liver problems when taken in excessive doses. In the United States, we estimate there are about 56,000 overdoses with acetaminophen every year, and the recommended dosage was recently reduced. One challenge in calculating recommended maximum doses per day is that often all of these pain relievers are ingredients in other prescription or non-prescription medications. So you can't just say, I didn't take that many Tylenol pills. You have to look at, was acetaminophen also an ingredient in one of the prescription meds or one of the backache or migraine relieving pills you picked up at the store? Other over-the-counter pain meds, ibuprofen, naproxen, they're both analgesics, both anti-inflammatory, and both have side effects. They may irritate the stomach, and they can cause damage to the liver and especially to the kidney if taken in excessive doses. Cold medications may include many ingredients. Pseudoephedrine is a common one. It's a decongestant, but because it's used as an ingredient in manufacturing methamphetamine, it is now sold behind the counter. Expectorants are something that break up the phlegm. Antitussive ingredients suppress coughing. Dextromethorphan works like PCP and ketamine when taken at high doses and can cause hallucinations. So while it can be very effective to suppress coughing, teenagers have discovered that if they drink enough of it, they can begin to become intoxicated and hallucinate. Antihistamines, taken for allergies, can also sometimes be used to cause sleeping and cause a great deal of drowsiness. Notice that any of these ingredients can be combined with alcohol in a cold medication. If you're using cold medications, I would suggest looking for ones that say they're child safe because those will not contain alcohol, or read the list of ingredients carefully and make sure that they do not contain alcohol. Over-the-counter stimulants and sedatives. Caffeine is the most common over-the-counter drug. It is used as part of the stimulants to keep people awake, but it's also a common ingredient mixed with other drugs to prevent headaches and so on. Antihistamines can be used as sedatives. Their side effects typically involve a dry mouth. Herbal products, most have questionable research. The dosage is inconsistent. So when it says you're buying 200 milligram capsules, this is sold by plant weight, not purity. The amount of oils in that leaf that's been harvested may vary widely depending on who grew it, how it was dried, and so on. Most of these products are recommended by vitamin stores. St. John's wort for depression has the most scientific evidence of any, but shouldn't be taken in combination with prescribed antidepressants. There are problems whenever combining any of these herbal products with prescription medication. Some other common herbal products include ephedra. There are two different species of this plant. One grows in the Pacific Southwest deserts of the United States, the other in China. Ginkgo, which has been sold as a smart drug. Kava, which is supposed to be relaxing and works on the GABA receptors. Melatonin helps with sleep, may affect dreaming. St. John's wort for depression. Valerian has kind of benzodiazepine effects, and many more, mostly unresearched. Consumer Reports did a study and identified quite a number, I believe it was about 30 different herbal products that are being sold, which if taken in excessive quantities can be damaging to organs in the body. So it's very important to know what you're doing if you're going to use herbal products. I suggest that you keep a list of what you're taking, brand name, weight, and so on. And whenever seeing your medical doctor, make sure to let them know that you are taking herbal products and what you are taking. Inhalants are another group of drugs that we need to take a look at. The method of administration is the common characteristic of these drugs. They may be almost anything, but it's the propellants that make them inhalants. They may produce a dizzy, euphoric feeling upon inhalation. There are two main routes of administration, huffing and bagging. In huffing, the solvent or the liquid might be soaked in a sock or a rag and stuffed in the mouth, and then the person breathes through it. In bagging, the inhalant, the liquid spray can, is sprayed into a paper bag, and then the person puts that over their nose and mouth and inhales that. There are significant problems with the use of inhalants. They have caused sudden death due to cardiovascular collapse, psychotic behavior, movement disorders. There's liver and kidney toxicity, damage to the brain's cortex and cerebellum, headaches, trachycardia, and eye problems. Inhalants, unfortunately, are the drug of choice of elementary school children, often in the lower grades. They're readily available under the kitchen sink and in the garage. Inhalants can include such things as glues or adhesives, aerosols, paint, whipped cream, hairspray, butane gas, solvents from correction fluid to nail polish remover, nitrous oxide, nitrites, poppers, and gasoline or paint that's found in the garage. Kids try this in an effort to alter consciousness, to get a high, not knowing about the potential sudden death from cardiac collapse or the long-term damage to their body. Terminology that you might have heard in this video or might be necessary to understand this subject matter include acetaminophen, in America commonly known by the brand name Tylenol, but in England and Europe known as paracetamol, see, hard for me to pronounce, acetylsalicylic acid, which is aspirin, analgesics, anabolic steroids, antihistamines, antitussive, estrogen, GRAE, generally recognized as effective, GRAS, generally recognized as safe, ibuprofen and naproxen, OTC, an abbreviation for over-the-counter, progesterone, and testosterone. What you should have learned from this chapter in this video. This is an odd group of readily available items, and so there are a lot of things that might have been new to you. Over-the-counter and prescription medications are commonly abused. Birth control pills may create symptoms that look like a mental illness or physical ailment. The steroids that are sometimes abused because they create muscle growth are called anabolic steroids. The steroids that are taken for breathing are called catabolic steroids and are very different from the ones that are abused. Over-the-counter medications are regulated by their ingredients, not the brand name or the combination of ingredients. The four major pain relievers which are available over-the-counter are aspirin, acetaminophen, ibuprofen, and naproxen. All of these can cause problems when taken in excessive doses. Herbal products are largely unregulated and potentially harmful. Inhalants are a significant drug of choice for younger children.